Well, good afternoon, everybody. I see that it's 1 o'clock. We are recording this session today, and anybody who joins our session, we will send you a copy of the recording because Dr. Page has graciously allowed that to put it on our webpage along with her slide deck. So welcome. My name is Patty Taylor. I am the Director of Quality and Patient Safety, the Director of Community Health Collaborative, and Mental Health First Aid here at the Dallas-Fort Worth Hospital Council Foundation. This is our fourth series in our opioid series, and we will be doing 6 more before the end of August 2022. This is due to a grant that we received from the Texas Department of State Health Services, and I am so pleased that I got to meet Dr. Page, and she agreed to be one of our speakers. So at this time, I'm going to turn this over to Dr. Page, and I did notice that somebody put in the chat where they're from and what they do. I would love to see more of that if you would like to put that in the chat and let us know why you joined us today. So at this time, I'll turn it over to Dr. Page. Thank you.
All right. Excuse me. So good afternoon, everyone, and thank you for joining us for this session today. I appreciate it. And thank you, Patty, for extending the invitation to me for me to present today. So before I get started, I do want to just share a little bit about me. So I am Dr. Stacy Page, and I'm a licensed chemical dependency counselor and a mental health professional. So I have extensive experience in the mental health areas and also substance abuse treatment. And as far as populations I've worked with primarily adult and adolescent populations, doing a variety of mental health services and substance abuse treatment. And I've also done individual group therapy and family therapy with those populations. I'm also a college professor. I do teach at Amberton University, where I'm an adjunct professor, and I teach in the psychology department. Okay. And lastly, just to round out my experience, I'm a certified life coach. So I do help individuals in the area of personal growth and professional development. So we will go ahead and get started today. So as far as my topic today, I will be presenting on relapse prevention. And in this presentation today, I'll be talking about what relapse prevention is. I will be talking a little bit about drug addiction and how it ties into relapse prevention, how the two connect. And then I'll also talk about what a relapse prevention is and talk about the components of that plan and offer some strategies that clients can actually use when it comes to relapse prevention and staying on track for sobriety. Okay, so for objectives today, one, I am going to start out by defining relapse prevention and what a relapse prevention plan is. I'm going to identify strategies to help prevent drug relapse. And lastly, I will discuss how to create a relapse prevention plan. Okay, so for the agenda, I'm primarily going to focus on drug addiction and talk a little bit about drug addiction. Then I'll move on to relapse and triggers. Then I will talk about relapse prevention. And then I will talk about the relapse prevention plan as my last content there. And then I will also have a time at the end for any questions that anyone may have. All right. So in today's time, we do know that we do have an epidemic as far as it comes to drug addiction. And drug addiction is a common disease. So it's not anything new that we've never seen. It's just now we are living in a time where we are seeing more individuals being addicted to drug and alcohol. And of course, it is due to the effects of just different life stressors. And at any given moment, we can have a life stressor, be it a minor stressor, so maybe just, daily hassles of maybe commuting to work, or maybe if you're actually doing remote work, just having to make sure that you're staying on task and on schedule. And then also those stressors can range anywhere to major stressors, which are typically the traumatic stressors. So maybe having some type of abuse, be it sexual abuse, mental abuse, physical abuse, or maybe even just witnessing some type of traumatic event. And so what happens when we are not able to deal with our stressors, when we don't have good coping skills? Typically, we're going to turn to another person or maybe it's a thing in order to cope. And so again, there are many people that they actually turn to drugs and alcohol and able to cope with their major life stressors or just daily life stressors. Excuse me. So we will see a lot of people just worldwide that are actually affected by drug addiction. So drug addiction is going to be characterized by intense drug cravings and the inability to control drug use. So for anyone that is addicted to a substance, be it alcohol, be it cocaine, be it marijuana, be it heroin, or any other type of drug, they will have the intense cravings for the drugs. And so typically when they do get stressed out or they encounter some type of stressful situation, instead of them using appropriate coping skills and stress management techniques, they're going to use to drugs because what they want to do is basically self-medicate in order not to experience whatever event that is. And then typically these people cannot control their drug use. And the drug use is going to interfere with their life. It's going to interfere with work life to where maybe they are not able to keep a job or maybe not be able to function well in a job. If they're in school, they will miss school, just have no desire to learn there, be engaged. And even at home, it can also cause issues at home. So, of course, when it does interfere with any type of life component, be it home, be it work, be it school, typically we are going to diagnose these individuals with a substance use disorder because they are struggling in that area. So when it comes to drug addiction, there are many individuals that they do decide that they want to receive some type of treatment so they can actually stop using the substances and become sober. Typically, a lot of these individuals, they may have some type of experience or some type of event that happens to where they will seek out treatment. So there are some individuals where maybe they actually get caught with the drugs on them, then they have some type of offense. And when they go to court, part of their actual court judgment may be for them to participate in substance abuse treatment. There are many individuals, they just seek out treatment on their own because they do realize that they do need help in this area. So they may reach out to either an inpatient program or an outpatient program. And those are the two types of treatment that we will see. So inpatient is actually going to be the person going to a mental health treatment center or maybe a drug treatment center, and they will usually stay there anywhere to about 21 to 28 days, just depending on what they need help with. Okay. And so they can go there. A lot of places they do offer, of course, on-site housing and shelter. So they can stay for the 21 or 28 days and then be released to an outpatient program. As far as outpatient services, you will typically see IOP and SOP. So IOP is going to be intensive outpatient treatment. So that is where the individual will attend treatment sessions, be it individual sessions or group sessions, about 4 to 5 days a week for a specified amount of time. Once they complete IOP, they will actually step that individual down to what's called SOP or supportive outpatient treatment. Typically, for that type of treatment, the individual is going to participate in treatment about 2 times a week. Sometimes you'll see 3 times a week. It just depends on, of course, the nature of their issues and how well they are doing with their treatment. And so when it comes to treatment, there are many individuals that do well in inpatient treatment. And it's because, of course, they are in an isolated environment. So they don't have any type of access to drugs. They're not around people that maybe they use drugs with. So they typically do well in inpatient. And then once they get to outpatient, a lot of people do well too. But we do know there are some people that they will relapse after treatment. So, relapse actually occurs when a person returns to substance abuse after a period of sobriety. So, typically, when individuals are out of inpatient treatment and they're doing the outpatient treatment, they are in their period of sobriety. And what happens is relapse is actually just a series of setbacks along the way to recovery. So, you will see individuals that They may do well with sobriety for a period of time, but then they may have some type of setback. Typically, the setbacks are caused by triggers. And so, in just a few minutes, I will talk about the different types of triggers and what they are. Relapse is very common. And so, right now, about 80%, about 85% of individuals relapse and return to drug use within the following year after treatment. So, we can see that is a large percentage of individuals that actually relapse. So, with that number, most individuals are going to relapse. Okay. And so, the relapse is going to happen usually within the 1 year following their treatment. Most individuals that do relapse, about 2/3 of these individuals, so they're going to relapse within the first 6 months after recovery. So we can see that 6 months is not a very long time. Typically, within the first 60 to 90 days after treatment, that is where we're seeing individuals relapse the most. And when it comes to relapse, it can occur at any stage of recovery. Sometimes it can be at the very beginning, as soon as they get out of inpatient treatment, if they were inpatient treatment. Okay. And then other times it may be maybe in the middle of their sobriety. Maybe the person has been doing well for about 7 or 8 months, and then they'll have some type of stressor that will get triggered. And then we see them relapse and return to using substances. So it can occur at any phase of treatment. It really just depends on the person and if they have a good relapse prevention plan in place, and also if they are motivated to actually stay sober. All right, so triggers. So, triggers is actually one of the most important things that we talk to our clients about and help them identify when they are in substance abuse treatment. So once we talk to our clients and we determine what's the cause of their substance use, then we want to move on to identifying their triggers. There are a lot of individuals, they are not aware of their triggers. And it's only because they've gotten so accustomed to using drugs that it is automatic. So when a trigger is happening to them, they don't even realize it because it's just an automatic thought that is playing in their unconscious part of their mind. And so when it happens, their only action they know to do is actually to go out and use a drug such as an opioid, such as heroin, in order to not have to deal with the negative emotions they're experiencing. So I do want to go through 10 of the most common triggers and discuss those. The first one is withdrawal symptoms. So there are a lot of individuals that what triggers their relapse is withdrawal symptoms. So when it comes to opioids, there are a lot of withdrawal symptoms. So usually they'll report feeling sick, usually flu-like symptoms. So the body aches, the sweats, not being able to tolerate anything on their stomach. So the vomiting, the headaches, those type of symptoms. So a lot of individuals, they do not want to experience the withdrawal symptoms. So when they are having those symptoms, when those things are happening, the headaches, the body aches, not feeling well, being sick, then they will want to return to using that substance because, of course, using the substance, that is going to take away the symptoms. A second trigger is going to be mental health and stress. So again, typically stress is going to be our main factor when it comes to people experiencing mental health and substance abuse issues. As we know, life can be very stressful. We do have a number of stressors that we go through just on a daily, a weekly, a monthly basis, even sometimes longer than that, if we are not able to use our stress management techniques to eliminate that stressor from our life. So when it comes down to it, there are some individuals, they have mental health issues. So they may have anxiety, they may have depression, they may have post-traumatic stress disorder, which is PTSD. They may have bipolar disorder, schizophrenia. They may have a number of mental health issues that they have not addressed. And so what some of these individuals will do is instead of seeking mental health services, so maybe seeing a psychiatrist and getting some type of psychotropic medication to take or being involved in therapy to address their mental health issues, what they will do is self-medicate. So then that's where we see them turning to drugs and alcohol, sometimes in some situations both, to actually cope with the stress. So we will see individuals having those mental health issues and stress. So when their stressors get to be too much and it's too overwhelming, then they're going to turn to drugs to just release the pressure that they are feeling. Another trigger is going to be people. All right. So typically, when it comes to drug use, um, people that are addicted to drugs, they are around certain people, they're in certain places, and there's certain things that's going to trigger their drug use. So, for example, if they have maybe a significant other, maybe a boyfriend or a girlfriend that is using drugs, then they might be triggered too. So, for example, you'll have someone that maybe gets out of treatment, they're clean, they're sober, but then they may go back to that same boyfriend or girlfriend. And if the boyfriend or girlfriend is not sober and hasn't stopped using, then they may fall right back into relapse. Okay. So sometimes it's certain people, could be a boyfriend or girlfriend, could be a close associate, could be another family member. So sometimes people will actually trigger the relapse. Then it can be places. So typically there are places that individuals go to where they use the drugs. So some of them, it might be going back to, the old friend's house or maybe the family member's house. And those people are still using. So what happened is if they were to go, visit these people, they may get triggered at that point because they have placed themselves back into the environment where they were using drugs. And there are some people, they are not resilient enough, they're not strong enough to be able to say no if they go back to an environment where they were using drugs. And then there's certain things. So there are certain things that might actually trigger someone to relapse. So usually when it comes to this, it's maybe either some type of, smell, some type of sound, something that they can actually see. And so, for example, maybe there's someone that they were addicted to, say, marijuana. Well, they might just be, walking down the street and then they smell marijuana, and then that might trigger the relapse. So a lot of times we, tell our clients, be mindful of even, sights and sounds and things because that could actually trigger you and make you want to use again. Then there's poor self-care. So we know that self-care is very important. It is important for us as human beings to take care of ourselves. So to take care of ourselves spiritually, mentally, emotionally, and physically, those are the primary components of self-care. So there are many individuals that they are not taking care of themselves, so they don't get proper nutrition, they don't get any proper, exercise, not getting proper rest. So a lot of them, they're just not taking care of themselves on a personal basis, right? Then we have relationship issues. So there are a lot of individuals that they are in relationships. And so some of them, the relationship is causing them stress. Maybe there's a lot of strain in their relationship and they don't know how to deal with it. And of course, yes, we are humans and we seek out relationships because we want to be connected to someone else. We want that intimacy and we want that social support. But when it comes to people that use substances, a lot of times it's their relationships that is what's going to trigger the relapse. So they might be having a rough time in their relationship. And of course, they might not have really good communication skills or interpersonal skills and be able to express what they're feeling. And if they can't express those emotions, then what they're going to do is suppress them. And then when there's maybe a disagreement or argument in the relationship, they're going to resort to using substances. Then there's pride and overconfidence. So for this trigger, there are some individuals that they have a lot of pride and they are overconfident. So maybe they have been sober for 7 or 8 months. They're on track. They are doing well. So they're staying away from all the people, places, and things that might trigger them, to use again. Maybe they're doing the self-care. Maybe they're exercising, maybe they're, eating right, meditating, whatever it is they're doing. And so they think that they are okay. But then the day might come where they have a stressor that's maybe too overwhelming. And then that will actually make the person want to use. So sometimes it's just people being too overconfident and not knowing that recovery is a process. And because you've been sober 7 or 8 months and you're doing well, it doesn't mean that at month 9 or 10, you can't possibly be triggered and relapse. Then we have isolation and boredom. Typically, this is one of the primary factors that we see when it comes to
Dr. Stacy, this is Patty. If you can hear me, you are frozen. It looks like she's leaving and coming back. So if we can give it just 1 minute, she will be back with this very interesting presentation. So please stay tuned. Hang on. We'll just give her another minute to join us again. I know in the Dallas area, the wind is whipping around like you wouldn't believe. I actually came into the office to make sure that my home internet didn't have to support this because I didn't trust it. So just hang in there with us, guys. While we're waiting on her to return, I wanted to let everybody know that because you joined this session, any future sessions that we have, I will make sure you receive an email and an invite to any of them. And as I said at the beginning, we'll be having 6 more opioid sessions on different topics before the end of August 2022. See, I'm glad I came into the office. If I was at home, I would have been blaming myself that it was my internet. But we have all gotten so used to this since 2020. As my boss one time said, what is a virtual event without something going wrong? So we just go with the flow and we will wait for Dr. Stacy Page to return. And it appears she is back. Can you hear us, Dr. Page? Can you hear us, Dr. Page? Oh, see, she's leaving again, trying to reconnect. I wouldn't doubt that the wind did something. But we'll give her another minute to rejoin us. Thank you all for your patience. While we're waiting, if you haven't shared in the chat where you're from and what your title is, that would be pretty awesome. I love to get to know the people that join our webinars. Thank you to those that have already done that. And again, as we're waiting, as part of the Hospital Quality Improvement Contractor, which is a CMS program throughout the United States. I am one of the subcontractors of that. We invited everybody throughout the United States. So you'll see some people from different areas, which is super exciting to be able to get the perspective from different areas. So thank you for joining us. And again, everybody who joined or registered will receive the next invites. Anybody is welcome. Oh, I love Dong Bomb. I'm a Dong Bomb. Awesome. Keep those comments coming while we wait for Dr. Page to rejoin us.
There's a connection issue.
You're on.
Well, welcome back. She was just calling me, and we all understand in the world of virtual events, something's bound to happen. So we are glad you're back with us, Dr. Page.
All right, thank you. And I do apologize for that. Hopefully we won't have any more connection issues. So before I got cut off, I was actually talking about isolation and boredom. So when it comes to isolation and boredom, this is typically one of the biggest factors when it comes to relapse. So there are a lot of individuals that, due to their drug use, they were isolating themselves. And so what happened is, after they actually get out of treatment, what they will continue to do is isolate. And of course, we caution our clients against isolation. We do tell them that sometimes isolation, is necessary, just to actually pull back from anything, that may be happening. But we don't want them to isolate for long periods of time. And so sometimes these individuals, when they're isolate, they are actually getting bored because they don't have anything else to fill that time. And so, of course, if we don't have activities to engage in that keep us active and keep our mind off of a lot of our issues that we have, then it is going to be easy for those individuals to relapse. And then lastly, emotions. Typically, emotions is going to also be one of the main factors when it comes to triggers of relapse. So when it comes to emotions, a lot of individuals, they don't have good self-regulation skills, and that is what actually led to their drug addiction. So when they're experiencing any type of negative emotions, be it anger, be it frustration, be it sadness, what they do is, instead of using healthy coping skills to regulate their emotions and calm themselves down and bring them back to a balanced state, they will typically just want to indulge in some type of activity that is going to help them feel better and get rid of the negative emotions. So for individuals that are addicted to drugs, what they're going to do is typically they're going to go use again because they don't want to feel the negative emotions. And of course, while they're under the influence, while they're under the influence of the drug, no, they, are in a good mood. They're not feeling any of the negative emotions, but then they do have to realize that once the drug is out of their system, then all those negative emotions are going to come flooding back. Okay. So those are just typically 10 of the most common triggers of relapse that may actually send someone back into using drugs. All right, so stages of relapse. There are 3 stages of relapse, which are mental, emotional, and physical. So for the mental stage, which this is typically where it begins, the person is going to fantasize about using drugs or alcohol. And what they will do is just replay those past experiences where they were using the drugs or maybe using the alcohol and thinking about how it made them feel. Then next what's going to happen is the cravings are going to kick in and the person is going to start craving the drug again. And then they will usually come up with a plan to relapse. And so this is where the person makes the decision that they're going to use again. Second is the emotional stage. And a lot of people, what they will do is they will hide their emotions. They will suppress their emotions. So they might be angry, they may be frustrated, they may be sad. And instead of expressing the emotions and being able to process and vent to deal with their emotions in a healthy way, they suppress those emotions and they will make you think that everything is okay when it's really not. And then we're going to see them start avoiding others. So this is typically where the isolation comes in. So when it comes to emotional, a lot of times the individuals will stop being around family members, stop being around their friends, they'll stop going to their support meetings, may even stop coming to treatment because they're avoiding others at all costs because they don't want anybody to know what's going on with them. Then lastly is going to be the physical stage where the person does return to using the drugs or the alcohol. So this is where we see them just carry out their plan and then they will actually go back into using the substance. Okay, so what is relapse prevention? So when it comes to relapse prevention, this is one of the areas that we target in substance abuse treatment. And what we want to do is help the individual come up with a plan so they will not relapse. So relapse prevention is very important and we do this with every client. So it is used to treat drug addiction, substance abuse, and mental health disorders. So it's across the board. We will do it for any type of substance abuse or drug addiction or mental health disorders. Relapse prevention, it helps us identify high-risk situations where an individual is vulnerable to relapse. Again, a lot of individuals, they're not quite aware of what will make them relapse. They might be able to identify a few of those triggers, but what we want to do is be comprehensive in nature and make sure that they identify as many triggers as necessary so they can see what their high-risk situations are. So high-risk situations may be being around a certain person where they're going to be more prone to use, or maybe putting themselves in an environment where there's a lot of drug use. And then lastly, relapse prevention uses cognitive and behavioral coping strategies to prevent future relapses in similar situations. So relapse prevention, we're going to help that individual identify situations where they might be most likely to relapse. And then we're going to help them determine some strategies they can use that will help them hopefully prevent any relapses. So for the cognitive strategies, these are going to be any type of mental strategies they can use, such as positive self-talk, maybe mindfulness, maybe meditation. Okay. And then for the behavioral coping strategies, these will be things as far as maybe distracting themselves. So maybe going to exercise, maybe listening to music, maybe engaging in some type of activity that is going to take their mind off of using those drugs. So when it comes to relapse prevention, we do focus on the cognitive aspect, which is going to be the mental aspect, and also the behavioral aspect, which is what actions they can take that will keep them from relapsing. All right, so what is a relapse prevention plan? So for a relapse prevention plan, it is a written plan that helps an individual, one, recognize the signs of relapse, two, avoid any triggers, and three, prevent a return to chronic substance abuse. So for the relapse prevention plan, we do want to help the individual recognize their warning signs or their triggers that are most likely to send them back into relapse and using. We want to have a plan so that they can avoid those triggers. So avoid the people, places, and things and situations that may trigger a relapse. And then also, it is designed to help the person not return to any type of chronic substance abuse. So there is where we want to do the prevention so the person has a plan they can follow, which will hopefully keep them from relapsing and using. So what's the purpose of a relapse prevention plan? So the purpose of the relapse prevention plan is to help individuals stay on track during their recovery process. If an individual has a relapse prevention plan, most likely they're going to be successful because they do have a written plan that's going to help them stay on track during the recovery process. Okay. Also, the relapse prevention plan, it minimizes the damage and helps individuals get back on track after relapse. So if they do happen to relapse, okay, after a period of sobriety, this plan will help the person get back on track. And then lastly, it is going to help the person be successful in recovery. So research will show if a person does not have a relapse prevention plan, they are most likely to relapse. And these individuals typically relapse faster, usually within the first 30 days after treatment, because they did not have a plan in place. They thought they were okay, but then they were not. So if we have a prevention plan in place, we have a written document that the individual can follow that will help them on the way to recovery. All right, so what's the components of a relapse prevention plan? So three main components are: one is a personal self-care plan. The second component, identify techniques to deal with urges and cravings. And three, create a list of people to reach out to if the person does use drugs or alcohol. So the main components of the relapse prevention plan are: one, the person will have a personal self-care plan. So of course, self-care is going to be the biggest part of the plan. We want to make sure that the person is taking care of themselves in all aspects. Two, we want to help them identify some techniques they can use to deal with the urgings and cravings. So again, when those urgings and cravings kick in for that drug, what are some techniques that they can actually deal with the urgings and craving? So this is where good coping skills come in and good behavioral coping strategies come in. And then lastly, we always make sure that they do have a list of people they can actually reach out to if they do use, because we don't want the person to use and just think all is lost. We want them to be able to reach out to someone else and say, hey, I've used, and then those people can assist them in getting back on track. All right, so creating a relapse prevention plan, right? So in creating a relapse prevention plan, and again, this is something that we do with all of our clients before we actually terminate their treatment, because we want them to have that written plan in hand, okay, when they are actually leaving the treatment facility. So that way they will have something they can look at and follow. Because after they leave treatment, we're not seeing that person on a daily basis anymore. So again, they're going to be either an IOP, which is an intensive outpatient. So yes, they're being seen 4 to 5 days a week, but it's typically for an hour or maybe an hour and a half. And then if it's supportive, of course, we're only seeing them maybe 2 to 3 times a week, again for about an hour. So in the rest of those hours, we want that person to be able to pull out their plan and to use their plan, because again, we don't have the same amount of time, or we're not spending the same amount of time in outpatient as we did with them in inpatient. So the first step is to take time for self-assessment and reflection. So one, when it comes to relapse prevention plans, we always want the person to take time out to do some self-assessment and reflection to see where they are, see how they're doing, and then reflect on where they were and where they want to get to, right? So this is the time for them to ask themselves some questions, and we typically have questions that we go through with them. Some of those questions are: why did they begin to use in the beginning? What triggered their drug use? What was it? Because of course they need to know that. Number two, were there certain people that maybe were a factor in them using drugs? Maybe were they hanging around a lot of people that were using drugs and that began their drug use, okay? What thought patterns did they have when they started using the drugs or continued to use the drugs? So for that, we would want to know, what were they thinking when they were using drugs? What type of thoughts were they having when the drug use actually got triggered? And then lastly, Why did they
Uh-oh, I think you froze again, Dr. Page. Okay, so everybody, we know the drill. We'll just be patient while she reconnects. So while we wait for Dr. Page to rejoin us, in the chat, maybe is there anything that you've learned so far or have experience using that has been helpful in your opinion? The last time it didn't take her long to reconnect, so if we can all just be a little patient, we will get her back. Yay, she's back.
Yes, I'm back. So I just found out that we're having some power outages in my area. So that's why it's disconnecting me.
That makes sense. I told everybody the wind here in Dallas is just, whew. So
So
welcome back.
yes, okay, thank you. Yes, it's very windy, so I think that's why it's causing the power outages. So hopefully we won't have any more before I am finished. Right. So again, I do apologize. So I'll pick up where I left off. So I left off on taking time for self-assessment and reflection. So for self-assessment and reflection, again, we want them to ask themselves a question: why did they initially stop using? Why did they continue to use? Did any people factor into that? And then lastly, if they did have a period of sobriety, why did they relapse and start using again? So those are some of the questions that we want to go through, and then we're going to devise their plan. So this is a collaborative approach. So the client is involved in their relapse prevention plan, and we, as the counselor, as the treatment provider, we don't just make the plan for them. They are instrumental in creating this plan because, of course, it is for their use. So number 2, recognize your triggers and warning signs. So of course, by the time we get to the relapse prevention plan, we have already identified their triggers. We have talked about their triggers and some ways to avoid the triggers. So we tell them the triggers are your red flags. So if you are in a situation and you experience a trigger, that is your red flag that you need to start using your coping skills. Okay, so use your self-talk, remove yourself from the situation. Better yet, don't even put yourself in the situation where you might be tempted. So we will list out all of their identified triggers and help them actually come up with ways or techniques that they can avoid the triggers. Number 3, plan for the worst. Now, there are a lot of people, a lot of our clients and other individuals that say, well, why should they plan for the worst? And it's because we know individuals that use drugs, they are going to have situations where they're going to get triggered. It's going to be stressful. So we want to make sure that they are prepared for that. We do not want them to be under, the illusion that, oh, everything is going to be fine, because we know that life is still going to happen. So we tell them, plan for the best, but expect the worst, because it just might happen. So what we want them to do is, of course, write out their plan at this time, and then identify the coping skills they're going to use should they find themselves in a situation where they might want to use again. So we're going to tell them to do the deep breathing, stop, do the deep breathing, maybe do the counting in there also if they want to or if they need to, how to get themselves out of environments or stay away from environments that are those high-risk situations for them. Also, use their mindfulness. So maybe, just stop in the moment if maybe there's some type of urge or craving that hits, to take their minds off of that so they're focused on something else. Definitely use their positive self-talk, because they can talk themselves hopefully out of it. Okay. And then also engage in maybe any other type of activities that will distract them from wanting to use. And then involve others. So we do want them to involve others in their treatment. So typically, if it's an adolescent, we are definitely involving the family. We're getting the parents involved there, or whomever their guardian is. We want them involved so they can help the adolescent. When it comes to an adult, we want them to involve others too, because we know that we do need social support, because we do have these life stressors and we have to live life, and having somebody else there to help us, that will hopefully get us through those stressful times, because we will have that needed social support. So involving others, it's reaching out to a family member, maybe reaching out to a friend, reaching out, to maybe a therapist or a sponsor. Maybe if they're in Alcoholics Anonymous AA or Narcotics Anonymous NA or any other type of support group, reaching out to somebody if they have an urge to use, or if they do relapse and use. We want them to reach out and not just feel like they have failed and there's no help there. So we encourage them to reach out to others and involve others in their recovery process. And then lastly, set goals for a healthy lifestyle. Again, self-care is very important. So we want individuals to live a healthy lifestyle in all aspects. So we will tell them to set daily, weekly, and monthly goals. So maybe if they haven't been exercising, start to exercise. Maybe start out with maybe 10 minutes a day walking, and build that up. We want them to get nutrition. We want them, to eat healthy. We want them to see primary care providers and make sure that they're getting, their checkups. And if they have any type of other health issues, making sure that they are being treated properly for those. And then also we teach them teach them stress management skills. So when they do have stressful situations, the skills that they can actually use to either reduce or prevent the stress. Okay. So all in all, we want the person to take care of themselves in all aspects. And then hopefully, if they are focusing on those areas, they're meeting their goals, and they're carrying them out, then they're going to stay on track. Okay. So again, these are the components of a relapse prevention plan. So number 1, we're going to do assessment, have them recognize triggers and warning signs, plan for the worst, involve others, and then set those healthy goals. So once we get the plan, we're going to, of course, put it in writing. And we ask them to always review their plan and revise it if needed, because sometimes maybe a new trigger may come up. So we'll tell them, go back in there and add that trigger, because now you know it's a trigger, and then plan for how you're going to deal, with that trigger. Or maybe they've gotten into a support group and they have a sponsor. Add that to your contact list of people that you can call. We tell them, definitely revise their goals. As they're meeting goals, set new goals so that they always have something that they are working towards. And again, the relapse prevention plan, it is a fluid document, so they can always change the document at any time to make sure that it's fitting them. All right, so in conclusion today, I talked about learning what a relapse prevention plan is. And of course, that is a plan to help individuals on their road to recovery. I also talked about some strategies to prevent drug relapse. Primary ones there are going to be contacting others and making sure they're involved, using good coping skills such as meditation, doing the positive self-talk, doing the mindfulness, and also learning how to create a relapse prevention plan. And so that was the last slide I talked about. So just doing the self-assessment, being aware of triggers and warning signs, playing for the worst, so coming up with those good coping skills and stress management skills, having that contact list so they can reach out to someone, and then of course creating healthy lifestyle goals so that they can make sure that they are engaging in self-care and taking care of themselves. And this will conclude my presentation for today. And now I will open it up for questions. Does anyone have any questions they would like for me to answer?
And Dr. Page, what I'm going to do is I am going to open up where everybody can have their mic and their camera. So beware, guys, that if you have your camera on, you're now going to be on screen. That way they can ask the question. Or if you don't feel comfortable with that, please put it in the chat.
Okay.
Any questions from anybody?
Dr. Pez?
Yes.
Yeah. So the problem here in Texas is many people think, I'm sure it's everywhere in USA, many people think doing marijuana is not they don't think it's a substance abuse disorder. They think it's good for health, and they think, it improves their mental stability. Taking all these medications for depression, anxiety has a lot of side effects. So they think marijuana is good for them to deal with the stress. They say once they started doing that, they feel better. They're able to handle the situation in their life very well. No, I mean, they don't think it's a problem. So no matter how many times I say, we are not in the same page.
Okay. Yes, you are absolutely true. There are a number of individuals, many of them that use marijuana, and part of it is just their perception about marijuana. They have heard that marijuana is a drug that does not cause addiction, so they don't view it as being addicted. And it's like you were stating, they say, well, when I use it, I think clearer, I'm able to do things. And I tell them, yes, it can have those effects, but I'm like, it still is an addictive drug. Marijuana is actually one of the gateway drugs. That's the drug that a lot of people use for the first time when they use a drug that actually sends them into their drug addiction. So I do a lot of education on that, and I let them know that, yes, you are addicted to that substance, or you can be addicted to marijuana, even though it doesn't have as many of the profound effects like maybe cocaine use does or heroin use does. I'm like, it still does affect you. It's killing your brain cells. It's slowing down your processing speed, not to mention doing, damage to their lungs. I'll typically, pull up pictures and show them that, the internal damage, it does to their lungs and their breathing airways. So I do have to do a lot of education typically with those individuals to help them see that marijuana, yes, it is a drug that is addictive, even though, yes, we have, for medical use. There are a lot of people that don't have any medical issues that are using it because they say it keeps them calm, when they're angry. It helps them calm themselves down. So it's really all about education. And hopefully those individuals will be open-minded enough.
Oh, she might have had another power surge. But I believe she almost got that question completely answered. We'll give her a second because there is a question in the chat I would love to ask her. So we'll see if she can reconnect. We do still have 4 minutes left. Appreciate, again, everybody's patience.
Good. Patty, how can we get these slides? Are we going to email us back? Email? How do we have?
Yes, ma'am. Everybody who registered, whether you attended or not, will receive the link to the recording and the slides.
Oh, that's wonderful. Thank you.
And that was a great question you asked, because with so many states legalizing marijuana, there's a lot of misconceptions around that. And I'm by far not an expert, but that was just my thought.
Yeah, some some of my patients are very smart. They say, Dr. Guju, look at my profession. I'm doing so well. Do you think marijuana is affecting me? It's not. If it is, I would have not performed so well. And some people think they are very smart, and they think it's not going to affect them at all. Even if it kills the brain cell, they say it may be killing some, but not everything. I'm still able to perform well.
Keep doing it though, and we'll see how many brain cells you have left.
Yeah, it's a great presentation. She's very nice.
I was so glad I got introduced to her. And we have a lot of experts on the call today. As I said, I'm going to be doing 6 more sessions before the end of August. So if you have a topic that you are passionate about, please reach out to me and we can set you up to do one of the presentations.
Okay, thank you.
See, somebody's typing, so I don't want to disconnect. We'll give her another minute to come back on. The weather has just been crazy here. I did like the one question in the chat about how can you use this in a primary care setting? That's the one I was hoping to get to ask Dr. Page if she can reconnect. And please give me a few days to get you, it'll probably be Monday. I will get you the email with the link to the recording and the slides.
Sure, sure.
From the comments in the chat, it seems like everybody felt it was well worth our hour. I know I learned a lot. Again, it's not my area of expertise, so I always learn something on these. I think at this time, we will go ahead and stop. If you have any questions for Dr. Page, I don't believe she put her contact information, but you can certainly email me and then I could forward it on to her to make sure. And again, on Monday out at the latest, you will getting the slides. So I think I have that it's 2 o'clock. We will go ahead and disconnect. Again, thank you everybody very much. We really appreciate your time and your interest in this topic. Have a wonderful day.
Thank you, Patty. Have a blessed day.
Thank you. Bye-bye.
Bye-bye.